Bladder sometimes confuses people. So let me first clear that there are two bladders in the body. One is called the gallbladder, which is in the digestive system, and other is the urinary bladder. The word bladder means a receiver or a receptacle. So the urinary bladder, which is in the genitourinary system, this can develop cancer because the lining of this urinary bladder is called urothelium, and the cancers of this system are called urothelial cancers. The common causes of these cancers are smoking, and it is also common, surprisingly for many of you it must be surprising, that it is common in the Nile Valley, where there is a special infection that occurs which causes urinary bladder cancers. Bladder cancer, first is a suspicion that the people who smoke can have bladder cancer. The symptoms can be painless blood in urine. Please remember, painless blood in urine in a man or a woman above 50 years of age can be an ominous sign of presence of bladder cancer. This is the single most important diagnostic mechanism where we suspect bladder cancer. Once we suspect bladder cancer, what we do is we plan the patient for imaging studies in the form of a special X-ray or a CT scan or a MR, which is MRI scan. Now, following this or along with this, we plan also for endoscopy to put a telescope into the bladder and have a look at the bladder if there is any tumor which can be seen. So, when we do this endoscopy, we bring the tissue from the bladder tumor and send it to the pathologist for examination, and they confirm whether there is presence of urothelial cancer or bladder cancer or not. So along with the imaging, it is important to complete the diagnosis. We need to do endoscopy in all these patients. Treatment for bladder cancer can be divided into two parts: superficial type of bladder cancer or deep type of bladder cancer. Superficial type of bladder cancer is good news. You need not remove the entire bladder from that patient. So the patient can have his bladder and void urine normally. The treatment is done by doing endoscopic resection, wherein you put a special instrument into the bladder and remove the entire tumor, and then put medicines inside the bladder so that the tumor doesn't recur. In the deep type of bladder cancer, it is dangerous to keep the bladder inside the patient. So in these patients, it is necessary that the patient be informed that this urinary bladder is dangerous and it has to be removed. So it is a major surgery, and the patient has to be counseled for that. Recently, for last few years, there are more newer techniques where we can give medicines in form of chemotherapy and give radiation in patients who cannot undergo this major surgery. So the mainstay for deep type of bladder cancer, which has not yet spread, is to remove the urinary bladder completely. Let us look at the after effects of the treatments again by dividing bladder cancer into superficial or deep. Superficial bladder cancer, as we said, the bladder need not be removed. So the person has to keep a watch on it. So if he has bleeding, if he has any problem, he has to visit the doctor frequently, maybe 3 or 4 times in a year, as the urologist would advise. As far as the deep type of bladder cancer is concerned, once the bladder is removed, the question is how would he pass urine? So we will have to divert the urine by surgical means, wherein he has to have a collecting system for the urine, either outside or it can be within the body, which is called actually a bladder replacement or a new bladder, in medical terms called neobladder. So there are ways where the person has to learn a new way of how his urinary system is going to be managed.